binge drinking and heavy alcohol consumption in U.S. men and women, life support in ICU patients and outcomes over the past decade, the new 2025 CONSORT guidelines for reporting randomized clinical trials. All this and much more on this episode of the JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, April 18th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. First up, a research article by Dr. Moen and colleagues in JAMA's Caring for the Critically Ill Patient series. These authors used the EPIC Cosmos database to look at nearly a decade of data on life support and outcomes in adult patients admitted to ICUs in 54 U.S. health systems. This timeframe included the COVID-19 pandemic. The investigators report that while in-hospital mortality and ICU length of stay increased during the pandemic, these have returned to pre-pandemic levels. They also note that fewer patients in the ICU are receiving mechanical ventilation, and more patients are administered vasopressor medications. Here's more from Dr. Moen in conversation with JAMA Associate Editor Dr. Chris Seymour on the JAMA Author Interviews podcast.
So, Emily, what happened to these important indicators of ICU outcomes after the pandemic?
So what we found, I think reassuringly, was that for the most part, these indicators returned to their pre-pandemic baseline after the pandemic. And one of our findings that was quite interesting was that although we chose in our study design to define the COVID pandemic period based on the WHO, statements by the U.S. president, sort of rigidly define that period, we found that some of those indicators kind of naturally returned to their baseline somewhat earlier, which I think is in keeping with the experiences of many in our communities and also in keeping with some of the early literature that has started to be published describing that late pandemic and post-pandemic period.
JAMA also published several research letters. Adrian Goudreau and colleagues investigated drug-related incidents, hospitalizations, and deaths from opioids and stimulants during the first year of drug decriminalization in British Columbia. They report marked reductions in police-reported drug possessions, but no associations with increases or decreases in opioid or stimulant-related hospitalizations or deaths.
Dr. Shui and colleagues contributed a research letter in JAMA's Women's Health series. The authors used the National Survey on Drug Use and Health to study sex-based differences in binge and heavy drinking among U.S. adults. They compared trends from 2017 to 2019 and 2021 to 2023 and report that overall, males continued to binge and drink heavily at higher rates than females. However, from 2021 to 2023, young adult females aged 18 to 25 years had higher binge drinking levels than males.
JAMA also published a research letter about body mass index in adults under 60 years of age. Dr. Airy and colleagues used data from the 2017 to 2018 NHANES to compare obesity prevalence with BMI compared with excess adiposity measurements like waist circumference or DEXA. These authors conclude that these different measures were nearly identical in assessing the prevalence of obesity.
Palliative care clinicians invite difficult conversations and often confront people with news they prefer to avoid. In their JAMA Viewpoint, Dr. Rosenberg and colleagues explore challenges in palliative care encounters and offer advice and encouragement for a sustainable practice. And there's a lot of concern now about NIH funding. In a separate JAMA Viewpoint, Dr. Yaya describes the stagnation of NIH funding since 2003, noting that additional investment will be required to train and retain a highly skilled research workforce in the U.S. Additionally, Professor Gostin and Dr. Bard also contribute a viewpoint about NIH funding. They describe Judge Angel Kelly's nationwide preliminary injunction after the NIH placed a 15% uniform cap on indirect cost reimbursements for all federally funded biomedical research. JAMA executive editor Dr. Kirsten provides an accompanying editor's note. He explains some even more recent updates, such as Judge Kelly's recent conversion of the preliminary injunction to a permanent injunction earlier this month.
Yes, thanks, Preeti. There's also a Viewpoint this week by JAMA Psychiatry editor-in-chief Dr. Dost Unger. He remarks on the formation of the Make America Healthy Again Commission and this commission's attention to mental health. Dr. Unger provides a helpful review of psychotropic medications and describes possible next steps for this commission for improving psychiatric care in the U.S. This week's clinical content features a review of cataracts. Dr. Chen and colleagues summarize the pathophysiology and diagnosis, as well as non-surgical and surgical management of cataracts. There's also a very interesting video on cataract surgery that accompanies this review. And in their JAMA Special Communication article, Dr. Hopewell and colleagues outline the updated 2025 CONSORT statement. As JAMA readers may well be aware, CONSORT stands for Consolidated Standards of Reporting Trials. The guidance, the CONSORT guidance, aims to improve the quality of reporting for randomized trials, and this new article contains the multiple updates to the 2025 CONSORT guidance, including a new checklist section on open science. Readers may wish to visit the JAMA website to download these materials.
Absolutely. These are important updates for all clinical trialists. Also important is communication with patients. As part of JAMA's Communicating Medicine series, Dr. Taylor and colleagues have a JAMA Insights article on communicating with patients about surgery. The authors identify 3 core communication skills with examples for integrating these into conversations with patients and families. I highly recommend the related JAMA Clinical Reviews podcast. We have a late-breaking Med News article by lead senior staff writer Rita Rubin, just published today. Experts inside and outside the CDC have been left stunned and puzzled by the decimation of a federal agency that has been a global leader in public health for nearly 80 years. Read this article to learn how drastic cuts to the CDC might negatively affect the lives of people in the U.S. and worldwide.
JAMA also published an article and podcast in the JAMA Plus AI series for medical news this week. Dr. Brant and Sunny Virmani sit down with JAMA Plus AI editor-in-chief, Dr. Roy Perlis, to discuss a deep learning diabetic retinopathy algorithm in India. Associate Managing Editor Kate Schweitzer shares their conversation about how AI could improve screening for diabetic retinopathy.
And make sure to also check out another MedNews article this week by MedNews director Jenna Bossi, discussing new insights on LDL cholesterol.
Yes, another week of great content at JAMA. Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.